Buenos días, estamos en el segundo curso de superficie ocular y aquí en el Conde Valenciana. Estamos con el doctor Sayan Basu2, que nos visita de la India, y queremos hacerle una entrevista. La primera pregunta, doctor, háblenos acerca de su nueva técnica de trasplante de córnea y qué tiene que ver con la oncología.
Tell us about your new technique in corneal transplantation and also keratoprosthesis and the outcomes you have found in this technique.
Okay, thank you very much. So today we are going to demonstrate two new techniques that we have developed at the L.V. Prasad Eye Institute in Hyderabad, and these techniques are for patients who have very severe eye disease. Because of some very complicated problems. Some patients have very severe burns in the eyes because of some chemical injuries, or some patients may have very bad corneas in which you cannot do a regular transplantation. So one of these techniques is called SLET or SLET, where you take a small piece of healthy limbus, which is the area between the black part and the white part of the eye, and you transplant it on the eye which has the ocular burn, which has got the surface has completely been burned because of some chemical injury or something like that, and you can restore it just like a normal eye. Okay, so we'll be demonstrating that, and Guillermo Mescua, who's from Baskin Palmer in Miami, he's also an expert in that, and he's been doing that in the United States for a long time now, so he's going to also demonstrate some cases. Because we have been collaborating with him for a long time. The other technique is called the LVP keratoprosthesis. It's based on the Boston Type 1 design, but you can use it in eyes that are completely dry, which do not have any tear function, and who are currently, they are classified as hopelessly blind, that you cannot do anything else for them. Any other surgery or routine transplantation is at very high risk of failure. So these are the two surgeries that we're going to demonstrate.
Ok, por último, doctor, ¿cuál ha sido su experiencia profesional en México?
What has been your personal experience, talking about professional experience in Mexico?
Okay. So this is the first time that I've been in Mexico City, and I think it's a very, very nice place, very lovely people, very, very warm and pleasant people. And it's in a very strange way, it's also very similar if you see the streets and the people here, and also the patients who come here with the kind of problems that they do. It's actually very similar to what we have in India. So it's strange, but it's very remarkable that so far across the globe you have two places that are very similar in terms of how the people are, especially the food and everything else is very similar to what we have in India. So it's actually very, I was pleasantly surprised, and Guillermo and Enrique always used to tell me that you'll like it when you go to Mexico, and I have to say that, yeah, they were right. And it's a wonderful place, very nice people, and I think the institute over here is doing a wonderful job. They do a lot of good cornea surgeries, and they have a great cornea practice, helping patients from all over Latin America, and I think especially in Mexico. And I think both personally and professionally, it's been a great experience being here in Mexico.
¿Algo más que quiera comentarnos en esta entrevista?
Any other comments you would like to add?
I would just like to say that I think it's a great initiative that they have organized this workshop on ocular surface, because it's a part of ophthalmology and in cornea service also, which is not very stressed upon, but there are a lot of patients who have ocular surface problems and they are very difficult to treat. So it's very important that cornea specialists, cornea fellows during their training get exposed to these kind of treatment options, which were not there 5 years ago or 10 years ago, and they're very recent developments, like the procedure that I was talking to you about SLET or SLET or LVP keratoprosthesis. These are very recent, in the last 2 or 3 years only they have come up, and now you have because you have these procedures, you can treat a lot of patients who were earlier considered as incurable. People used to say that they have incurable corneal blindness. Like if you had a patient who came in with that problem, doctors would say, there's nothing we can do about this. You probably have to stay blind forever. But now you have the treatment for that through these, and so it's very important that cornea fellows who are new in their training learn about these techniques, and they are able to provide these services because they're not very complicated, that they are able to provide these services to their patients locally at where they practice.
Muchas gracias, doctor.
Gracias.